Hello. I just want to take this opportunity to thank Harold for uh, asking me to give this talk on COVID and how its effect on children and adolescents. When they asked me to talk about this subject, I had no hesitancy because knowing that my patient has been affected by this, I know that a lot of people in the community are also affected by this illness, not just physically, but more emotionally and socially. So let me go to my PowerPoint. I named this my talk today, COVID, the Unseen Consequences. In the last few months, I've seen more and more of my patients suffer because of COVID, not from the physical disease itself, but from the isolation and all the problem it presented to the family. I'll talk more about the scenario a little bit later on. But as you recall, ever since February this year, we began to learn this term COVID-19. This is a new term to us. We realized something was coming out from China that's unusual. And then it went to Europe and then in America. And we begin to hear illnesses in Washington, California, and in New York. And we realized a lot of these people were getting very sick and the whole city was affected. And it began to hit Texas, Florida, Arizona. So by March, April, the city that we live in will begin to be closing. Now, which is considered third wave, this illness is pretty much everywhere. Like you, I glued to the TV every day to try to figure out what's going on. And there's no way for me not to look at the numbers. And we're aware or cognizant of what's going on with this illness, how it's affecting our country. As of last week, 21 million people in America have caught COVID. I would say this number is underestimated because at least 4 to 5 people that catch this illness have minimum symptom or they have no symptom at all, so they never got tested. Every day, out of 100,000 people, 6 to 8 people would catch this illness. And up to last week in America, 359,000 people have died of COVID. That's a big number. A lot of people have died of COVID. Ever since March, we've been seeing Dr. Fauci on the computer screen. We didn't know who he was, but now he's become famous. And we look at all the numbers that's always posted on the side of his picture. Then we learn a lot about the testing, how people have been tested in their car, and we see how cities become empty. And last week, we were so happy that the vaccine came out. And through the hard work of the pharmacies and the government, and finally, the vaccine have arrived. Through all this news that we've been watching, like many of you, I was a little bit nervous, fearful, and worried about what's going to happen. I watch it because I want to know what's going on in the news, and I want to know if there's anything I can do for my patients, myself, and my family. And by March, the schools in Houston was closing, the daycare was closing, and people were having to work out at home, and the kids have to study at home. Their parents now have been sent home. And the economy also began to sink. So there are a lot of anxiety and fears, and we're now all stuck. Being at home, if just for a weekend is good, but being at home by ourselves become isolation. We're isolated from one another physically, and also, even for physicians and the patient, we have to wear all kind of what are called PPE, and then face masks, gloves, etc. What is going through the mind of people that are in isolation? It become lonely. They have a lot of signs of just withdrawn and worry. So that's why it causes a lot of unseen damages to this loneliness. And this is something that we might not talk a lot about because this have not, in a sense, caused a lot of physical illness or damage, but it's causing a lot of emotional problem in children as well as in adults. And this is the main reason for this talk today. Let's take a look at how this interview of children from the National
Welcome everyone to Pandemic Parenting from Children's National Hospital. I'm Barbara Harrison. We know that COVID-19 has families tackling a wide variety of new parenting challenges, and Children's National Hospital is here to help you. One of the challenges, no doubt, stress. I've spent a lot of time over the last few months asking kids of all ages what life's like for them through this COVID-19 pandemic. They've shared a lot with me through my Kids Speak Out site, and they've talked about a little of everything from missing their friends to actually missing their classrooms.
The thing that bothers me the most is that we can't see our friends.
I know some people that can be quite affected, like their mental health, especially by not being able to see other people and going out and doing things that you normally would do. So,
do you think that, like, since now that I'm spending more time with my siblings, it's getting very annoying because, like, we're, like, pushing each other's nerves?
I have to be in, like, a real school, sitting down in a chair to be able to actually do schoolwork. So I'm taking more stressful because I can't go on a computer and learn.
I feel powerless in this entire situation, just watching my life get unraveled before me.
Well, what they're saying is that these children are saying is that my life, I don't know what's going to happen, and I don't get to do the things I used to. I don't get to see the friends, go do the activity, shopping, and I cannot learn in a virtual environment. I feel powerless, and my life is unraveled. Now, these two pictures put up. One is on the left-hand side is my interaction with patient. That's not me, but it shows that for a pediatrician, we like to build relationship with our kids. We talk to them, have fun, so that they can, understand that we're not being tough on them, mean to them, and they're not being afraid. So my kids actually talked to me when they're about 3 years old, or even 2 years old. So I remember there was a child that's 3 years old that came in for a checkup. But once she was 2, she was a very happy kid, a lot of energy, talks, pretty good at that point. But once she came in at 3, she was not talking, anxious, and that's that really his language is not really advanced a lot more, but she seemed to be nervous. And there was another child who actually was, when I saw her 2 years old, speech was okay. And when I saw her back last year for a 3-year checkup, her speech was worse than when she was 2 years old. The reason was that, her parents have to work, and she really was put with a grandparent, and they don't talk a lot. So as a result of that, she has speech delay. About 2 weeks ago, during the Christmas, New Year's time, I had 3 teenagers coming in for checkup. These are teenagers that I know have good family, stable family. We usually do a depression screening on them. All 3 of them had signs of mild to moderate depression, and I had to send them for extra care and also gave them some points to how to take care of them at home. So pre-COVID, people were happy. Post-COVID, it caused us a lot of issue. Both for children, it's more of developmental issue. For older people, older children, anxiety and depression. According to CDC's National Emergency Room Mental Health Evaluation, in 2019 compared to 2020, in 2020, there was a 24% increase of emergency room visits for kids 5 to 11 for mental problem. There was a 31% increase for children 12 to 17 years of age for mental problem that went to the emergency room. You know, children don't usually go to the emergency room for mental problem. They go there because they have something serious, like they have panic attack, chest pain. They might have cut themselves intentionally. They might try to commit suicide, you know, these are things that end up in emergency room for mental problem. Let's look at the statistics from other statistics. A national survey conducted in spring of 3,300 students found that nearly 1/3 of them were unhappy and depressed, much more than usual. And 51% said they felt a lot more uncertain about the future. It's important for kids to think well about the future. That's what gives them hope, aspiration to work harder and to be happy. So they lost a lot of that. How about overseas? In a study it was in Spain and Italy of more than 1,000 students, 86% reported change in the children's ability to concentrate. And they were just spending more time online and sleeping. And they were doing less physical activity. So they were doing a lot of unhealthy stuff and less healthy stuff. In China, they also did a study of 2,300 students, and they were found to be more anxious and depressed compared to previous years. So this phenomena of emotional problem is not only happening in America, but all over the world. What we talked about earlier was a high number of people going to emergency room. And going to emergency room is serious. Actually, a lot more people probably seek medical care from the doctor's office, psychologist, and social worker. However, I would also venture to say more likely, more of the people that have mild to moderate symptoms never get any medical care because the parents did not aware of it, or the parents themselves were too busy or have their own issues. So these mental illnesses might prolong, and some of them would affect these young people for life. So why do these children go through challenges and having these mental issues? If you think about a child's usually very happy, carefree. They run around as children, play with toys, and they go to the playground and play, ride a bicycle. These are things that help a children to learn, help them to learn how to speak, how to socialize, how to use the motor skill. But the changes cause them to just have a lot of change in their life, so they no longer get to interact this way. Due to closure of the school and the daycare, they stay most of the time at home. The parents are also home because of the job, but the parents are stressful because some of them do work at home, and they also worry about finances because a lot of organizations and companies are not doing really well. So parents are stressed. One of my friends who has 3 children, he is a very good guy, good relationship with the kids. But what he told me was that every day he's, work next to his kids. He's doing his work. After 2-3 minutes, he'll look around and see his kids. His kids is maybe doing something else. He will have to redirect his kids. And he does his work for 2-3 minutes, and then his kids would come to him and ask for something, maybe a pencil or just want some attention. He said his life is very stressed, and it's very difficult for him to focus on work and family at the same time. This is even a good family. So most of these kids lost their regular activity like the sports, the music, the soccer, the clubs, church, family activity. Some of them even lost the continuity of healthcare. Some of my patients that used to get speech therapy or occupational therapy, and they don't go anymore because they were sent to virtual physical or occupational therapy, and those therapy doing virtual is just not effective in children. And so after a while, they just basically stop. Some of these families even deal with housing and food insecurity. I know that for my church, we've been able to help out some of our community, our neighbors next to our church. And we did some survey. These are blue-collar people, and 80% of them said that someone in their family have lost their job, and they worry about next bill. So for our church, we provide them some food and for them every month to try to help them out some. So these children are going through a new lifestyle, a lifestyle of staying at home, being isolated. They spend most of the time watching TV, playing video game, or just be online. And now they're not doing as much exercise outside. They don't run outside to activities. There's less social activity with their family, their friends. And the life at home is a little bit more stressful because the parents are stressed. The parents at home doesn't mean the parents spend more time doing good activity with them. And the parents may be tired also. And they don't get to see the extended family or the friends. And also a lot of time they always talk about COVID. Even they go out, the parents will say, do you wear a face mask? Do you wash your hand? You got to do this so you can stay safe. And every day, I hear people talk about the number, how many people are being affected by the COVID, how many new cases there are. People even seem to memorize all that. It's always these things that makes you really anxious. As a result, children are going through a lot of social delay, speech delay, motor delay, because they don't get to do as much as they used to. And this is something we see in our practice. As lost, and some of them even lost security of physical or need-based, food-based security and safety. And as a result of that, they'd be more anxious. Children can also have anxiety, but they express it a little bit different way than older people. And we'll talk a little bit about that later. Sometimes these kids end up to be abused because the parents getting mad of their own situation. And when the kids, want attention or do something negative, they would yell at them or hit them. But sometimes these kids just neglected because the parents are tired and all this, and they just want to get away. And so they might not be able to cope or meet the physical needs of these children. How about teenagers? Teenagers have all the challenges that the children have, but they also realize is that they need to learn, they need to get better educated because they need that for the future. And they get frustrated when they cannot do online learning effectively, and they get frustrated when they realize is that they're behind or making bad grade, bad class rank. Children is a little bit different in this area compared to adolescent, is that adolescent really need to have a social relationship with a friend to be able to learn, to share ideas, to be able to, that's part of their mental health. And they need those community. This is the age where they join group sports, organization, and they miss all of that. And this would affect the emotions a lot. They also miss a lot of significant life events like birthday party, different success celebrations, vacation, and maybe perhaps like the graduating class in our church last year. These kids worked very hard, did really good work in their school, and they're going to graduate from high school, but they didn't get to walk across the stage like everyone else did. This is something they work hard for 12 years, but they didn't get to do that. They didn't get to go to prom, which is something they have looked forward to for a long time or heard about for a long time. And these are some of the things that would never come back. They can never redo that. So our youth, teenagers miss out on a lot of significant events in their life. As a result of some of that, this is what Dr. Candace Norcott said. She said teens struggle with seeing down the road into a post-pandemic world, and they're asking, what's the point? What's the point of working hard? What's the point of life? Teens are also not good at delayed gratification. They cannot wait to be rewarded for what they do. They cannot wait for next good things. So by losing milestones and rites of passages like graduation, birthday party, and athletic seasons, these are felt greatly. That means this affects them greatly. Dr. Norcott, she's a clinical psychologist and professor in University of Chicago. She said that enduring uncertainty of the pandemic represents a particular challenges for teenage during a crucial stage of their development. This uncertain, enduring, long time challenges, stress that has seemed to have no end, affect the teenage more than anyone else, because there's a stage of their development that needs more encouragement, more hope, and something to look forward in the future. Now everything is uncertain. So emotionally, our teenagers are being challenged a lot. So as a result of these challenges, they lost the education opportunity we talk about. They might even develop bad habit, be just playing a video game, watching TV all day long. They might go to bed late and would not want to wake up till maybe noontime or more. They become a little bit lazy. They also have poor health habit. One study shown, this study about 4 months ago, that average weight gain is about 5 pounds for people that have COVID, that have experienced this COVID isolation. And in my patient, I see that. They also have emotional changes, more agitated, unhappy, and ultimately it can lead to anxiety and depression like we talk about. Now, we talk about all the bad things about COVID, all the unhappy thing about COVID. If I was here to just talk about a negative thing, I don't think I would give the talk today. We will defeat COVID. We can defeat COVID, but there are a few things we need to do. One is to understand how COVID affects us. Two is that what we can do, what parents can do, what families can do in order to defeat COVID. Okay? I know we can do it, and let's do it together. Let's look at some of the important information about COVID. So this is the age distribution of curve of COVID. We know that COVID affects a lot of people. And let's look at this. So people, this is the age 85 years or more, 75 to 84. This is the children 0 to 4 years of age, from old to young. Now, for the older people, the percentage of people who get catch COVID is 2.6%. For the 75 to 80 years old, the chance for them to catch COVID is 4.1%. For 65 to 74 is 7.4% chance of these COVID people at this age. So all combined, all the people that have COVID from 65 or older is combined with be about 14%. So of all the people that have COVID, 14% people are 65 or older. But for the people that is 0 to 4, only 1.8% of COVID cases are from them. For the people 5 to 17, 80.8%. So combine these two, a little bit more than 10% people are younger age. So 10% here, about 15% here. The young and old only combined to be 25% of the COVID cases. So the bulk of the cases are between 18 and 50 years of age. These are main people that have the COVID. Let's look at the next graph. How about death? Who are the people that die from COVID? So this is again 65, 75, 85-year people. This is the main bulk of the people die from COVID. You combine all the percentage, 20, 27, 33, I add this up, it's about 60% of people are the ones that's older that are dying from COVID. For the people that are younger, about between 0 to 18, less than 0.1, 0.2% of the people are young that die from COVID. And most of the people in the middle age, 18 to 74, not that big a number. But I want to take a look at the next graph, and I edit and calculate specifically how many people of this age, if they catch COVID, what is the risk for them of dying? Let's say you're 65 or older, you catch COVID, that's a 9% chance you'll die. If you're 50 to 64, 4.4%. And as you go down in age, less and less. For 18 and 29 years of age, 0.04% people die from COVID. What does that mean, 0.04%? That means for every 10,000 people, only 4 people die from COVID at this age. How about 0 to 17 years of age? If you're 0 to 17, you catch COVID, the chance that you die from it is 0.014%. It is not a big number. That means for every 10,000 kids that catch COVID, 1.4 might die. And in total, last year, 239 kids died from COVID. Most of these have other serious illnesses like cancer and chemotherapy, severe asthma, severe diabetes. So the healthy kids doesn't have problem in most scenarios. You do see some in the news, but that's the unusual cases. So that's why they reported in the news, and it's more sensationalism also. So not that many kids die from COVID, but of course, even one death is a lot, okay? So let's look at comparison. When we compare flu death in 2019, 477 children died from flu, whereas in 2020, only 239 COVID kids less than 18 died from flu. So flu death is higher than COVID death. Let's look at the treatment for COVID. So most people get well by themselves, more than 98, 99%. And we realize that medicine effectiveness is limited. There's no special golden treatment that knock it out right away. And if you end up in a hospital, and that means you're very sick, the management is getting better through different methods combined. And we realize the hospitalization rate is less, even though there are more people being sick. And people end up in ICU is less than before because the effectiveness of the combined treatment is better. And we also know the vaccine can be 95% effective. So hopefully that all of you that needs a vaccine and will be able to get a vaccine next few months. Okay, so these are information that's important for us to defeat COVID. One, we know who are the ones that are at risk so we can protect them. So these are usually people 65 or older. They have obesity, diabetes, high blood pressure, immunocompromised patient, or lung problem. Not the kids, it's the older people. So we have to protect the vulnerable, the older people, by minimizing the spread. So the one thing that we need to do first is to minimize the spread. Who are the spreader? We talk about the age between 19 to 64, the ones that mainly have the illness, they're the spreader. So hopefully, if they do the appropriate preventive care, then our older people will not catch the illness. We also realize that children generally do not get very sick physically, but they can get emotional problem, mental problem because of COVID. So we need to also do the health prevention for them more from a mental standpoint, so they can be mentally healthy. So protect the old physically, protect the young. Actually, for everybody, protect everybody's mental health. But today I'm only going to stress on the young. How do we protect them? We realize most of the COVID is spread by air droplet when we breathe and when we talk to each other and sometimes cough on one another. And most of the cough droplet, can go about close to 5-6 feet. Okay. Now, so how to protect each other is through face masks. As you can see from the top picture, that when you don't have a mask, there are a lot of mist here. They can transfer to one another. When one person has a mask right here, it's a lot less likely that she'll catch the illness. But when they both have masks, it's very unlikely to go and catch the illness. But let's look at the numbers. So this guy here, he has the germ. He has the COVID virus. This girl does not. And if she wears a mask and he does not, that's a 70% chance of transmission. But if the sick person is wearing a mask, the healthy person not, then 5% chance that she'll catch it. If they both wear a mask, only 1.5% chance that the healthy person will catch it. The trick is this: 40% of the transmission is that a person can transmit the illness is already before the person show a lot of symptom, or even some studies say that 30% of people might not have any symptom themselves, or they don't feel much symptom, but they can transmit the virus. So what we're saying is that since we don't know if you're sick or not, everybody should wear the mask at all times to protect one another. So we all should wear a mask because we just don't know. It may be too early for you to show the symptom, even though you have the virus, or it may be that you're not going to have much symptom, but you still have the virus. So in order to protect one another, we should wear the mask. Everyone should wear a face mask. Another way to transmit is through these droplet that we have getting on an object. And so how long do these viruses live on these surfaces or objects? If it's paper, 3 hours, coin money, 4 hours, cardboard, 24 hours. So you have your delivery driver drop a box off the house. Some people wipe it down, a little alcohol wipe just in case. If it's on the table outside or other places, it can last 2 days. If in the clothes, can last 2 days. Stainless steel 2-3 days. Plastic ware 3 days. Glass 4 days. Paper money 4 days. Surgical gown 7 days. Or surgical mask 7 days. So don't touch other people's surgical masks. That is pretty dirty. So if you do all this prevention, you're pretty well protected. Face mask, social distancing 6 feet, wash your hand often. Don't touch your nose and eye, because let's say you touch an object that has the virus, you touch your nose and eye, that's how the virus gets in your body. And you need to clean the surfaces with disinfectant frequently, just in case. And for doctor's office, we actually clean it after every patient. And if you have any symptom at all, any cough, cold, sore throat, fever, achiness, loss of taste, smell, diarrhea, those are actually all symptoms of possible COVID. So you should stay home and get yourself tested. And when you stay home, you also need to stay away from your family so that they won't catch it from you. Okay, so prevention physically is important. 2 is to be aware if your child or your adolescent have signs of stress due to COVID, if there's signs of stress due to COVID. These signs of stress can be due to slower in milestone progression or even regression, like I talked about the kids that was not able to talk as well as she used to, and not improve in their speech or motor skill. They have fussiness or irritable, they're just unhappy, crying all the time, and no matter what you try to give them, they're not happy. They don't want to eat. They refuse the food that they used to like. They might, if they go out or go to places they used to like to play, maybe even playground or a friend's house, they're clingy to you, always wrapping their arm around your leg. They're withdrawn. They don't want to play with other children. They're hesitant to go to the playground, run to the play with other people, and they just want to be close to you, or they don't want to be doing things that they used to like. Some of the behavior may be more aggressive, like hitting other people, biting, and they just throw like more tantrum, yelling, crying on the ground. And sometimes they will have some physical manifestation of their emotional issue, like they would bedwet, that they did not bedwet anymore. They would wet on themselves, where even though they were potty trained before, or they even, some people known to go to the bathroom more often. So those are some of the signs of stress for in children. In older children, it's a little bit different. They might, we have some of those, the children want to, but more as you can see the weight changes. They may eat too much or too little and gain too much weight because they eat too much, and they lose weight because they don't feel like eating. They have poor attention and they cannot focus for their work, or you ask them to do something and they walk away and supposed to be going direction, they're going to do what you told them to, but then they just forget because their mind is occupied by things that are more stressful. They might do more poorly in school, whereas they did well before, didn't have any school problem. Now they cannot focus, they don't do well in school. They have changed their appearance. They might not dress as clean shaven. They do not care about their hair as much, and they just very sloppy. Sometimes they even go into risky or reckless behavior, like using alcohol or drugs, because they make them happy. So be careful. We have some of those items in your house. Some of the kids might get into it. So those are some of the signs of stress in older children. Some of the other signs that you can see are they get moody, their emotions up and down, they get angry real easily. When you ask them something, they might just bark back at you. And because all these emotional changes, they have conflict with the family and friends, and even cause them to withdraw from relationship because they feel like no matter what they do, they're wrong, or they have no hope for the future, and they just don't want to be involved anymore. And they would also lose interest in activity they used to like. Let's say you ask them to go play basketball in old days, what they want to go, but now they just say, I don't want to do it. They go, let's say, ask them to go to a movie, they don't want to do it. And I'll go see a friend, they don't want to see them. Those are actually more worrying signs. They also might have sleeping problem. So they cannot sleep at night. They cannot get good deep sleep, or some of them would sleep for a long time, do not want to wake up. So all those are related to stress. If you notice your children have any of those symptoms, I think it's worthwhile for you to seek medical care. I have two evaluation forms that your physician can easily use, and I know most pediatricians should have these forms, and I think it's important for you to seek medical care if they seem to have those issues that's not going away. The one on the left is called ASQ, Age and Stage Questionnaire, where we can look at 5 areas of a child's development to see if they progress as they should. It talks about communication, that means speech, gross motor, fine motor, problem solving, and personal social relationship. Oops. And then for the older kids, we use the PHQ-9 patient health questionnaire. Just look at how stressed or how depressed that they might be, and whether or not they have any suicide ideations. So these are two evaluations that I think that if you notice your children is not getting improving, you should seek medical care, and you can ask them to do these tests for you. Okay, so what can we do to prevent this problem or to help our children to become less stressed? So I want to talk about the little kids first. The children, these are maybe 10 years or less. One, you do have to maintain a normal routine every day, and so that they won't be seeing all the changes. Changes are not easy for kids. One, you have to, so you wake up same time, eat lunch, dinner, snack, nap at the same time, and then you have to have some family time. Actually, I think COVID time can be an opportunity to improve your family relationship and actually improve the future. I actually know family that are now spending more time doing projects together, remodeling the house, and they're having a great time. So COVID can be an opportunity. So you have to do some more family time. You have to playing games together. You can play board game, card game, even video game together, and talk things that you need to talk. Okay, and you need to be involved. Okay, and you can do more outdoor activity like walking in the park, spend weekend, go do camping, and riding your bike. There are a lot more activity, anything that you can think of that your family like. You can spend some time to do some more quiet stuff with them, read a book, and then talk about what they learned, or talk about what you've learned, listen to them, and encourage them to talk about what they read and what they learned. We talk about the family game outdoor already. Also do some FaceTime with friends and relatives, so they can connect it outside, because they might be worried about how the friends are doing or relatives are doing, and maybe do one of those every other day, or if it's possible, even do every day. And that's also a way for you to help people, your relatives, your children's friends, and get them to connect it. And if there are no vulnerable older people at home, you can even consider some healthy playmates, or even go to daycare. And so those are some of the things that you can consider. So for the general healthy balance, for the older kids, is make sure they do their illness prevention, since they're not always with you. So make sure they do all of that. And we talk about build a healthy family. You need to do that even with your teenagers. And we actually, in our church, we have a 3-month parenting class for our teenage parents. It's something that building a family is something that you need to continue to doing, no matter how old your children are. So one, to help them keep up with the family through media, help them keep up with their friends through media, and remind them there's something they should do. You make sure they go exercise and have a good walk outside, ride a bike, even play a little bit of sports with their friends, as long as it's healthy situation. Give some good hobbies. Maybe have them learn a new hobby, build some models, build some big puzzles, build a chair, something different, something that they feel accomplished. Increase family activities, like we talk about for the kids, and different game for older kids for sure. Even play some video game together. Increase those time. Do some games that's a little bit crazy that you don't usually do. You also set some new goals for the families. And like I said, one of my friends, he's remodeling his garage with his children, and the children's, one of them's elementary school, one in middle school, one in high school. So they all take part in that. The goal is to finish the garage. It's something, these are really good goals. I mean, this is a big one, but you can set smaller goals, together at home, some home projects, or learn how to cook together. And those are good things. again, a part of building family is to also remind them to limit watching news. Okay, the news is a lot of hype, a lot of anxiety, and you don't need to know the numbers all the time. And so don't watch too much news. You also should probably set some limits on internet or video game, because those cause children to be withdrawn, a bit unhappy, and it can be addictive. So those are actually rules I have even during regular time. Make sure to go to bed and wake up at the same time, get plenty of sleep. Sleep makes a person happy. Be thankful. Just remind them, what they already have. And we can always think about what we don't have. That's easy, but remind them what we already have. We have food on our table, clothes. We have a family. Everyone is still doing well. Remind them what we have. Ultimately, I think the parents need to take the lead in all of this. And for teenagers, yes, I think sometimes they're hesitant to do that, but you need to form a family meeting, talk about that. You need them to participate and make it fun. Let them make some decisions on what you want to do as a family, what kind of outing, where do you want to go, so that you can help them have some responsibility and make some decision, and they'll be a lot more happy to participate in this activity when you do that. Some other stuff you can also do is learn how to help other people. One of our youth in our small group, he's in 9th grade. He's involved in our outreach project to help with the local community. And one time I asked him, what have give you energy in lately, even though you kind of get stuck at home? He said, every time I go out and give the food to the poor, I feel happier. I feel like my life means something and I can make a difference in other people's lives. We see the picture on the right with, these are family, I think in Italy. They're very resourceful. So they just go on the balcony and sing and just play and just have fun. Try to be creative, do something different. You'll be helping not just yourself, we help other people too. Again, I talk about minimize news feed. The American Academy of Pediatrics strongly advocate that all policy consideration for the coming up school year should start with a goal of having students physically present in school. That means, as a group of pediatricians, we recommend that we do our best to send our student back to school, as long as it doesn't possess a big risk for the children or the family. So it's very important for them to go to school. So again, if there's no vulnerable people at home, old people at home, the kids should have some playmates, and it's important for them to go back to school. Yes, they still have to do some social distancing and face masks, but even with all those changes, restriction, kids are better served by going back to school. And it's also important that if you notice that your children have these symptoms of stress is not going away, you seem to be progressing, and you don't know what to do, please seek medical care. Please seek medical care. Do not wait. And this is my last slide. It talks about how parent needs help. Studies of adults during this time, the prevalence of depression symptom in the US adult has risen across the board. For mild symptom, it gone from 16 to 24% of the adult have it. Moderate 5 to 4.7 to 14.8% have it. Moderately severe 2.1% to 7.9% people have it. And then severe 0.7% gone to 5.1% of the adult have it. These are very, very scary numbers, especially severe one. 5.1% of the population have severe depression. And if you're an adult and you suspect, you worry, you have some of the symptom of stress, anxiety, depression I talked about earlier. You must seek care for yourself. We know that as parents, you love your children more than yourself, but you have to care for yourself first in order for you to care for your children. We talk about some of the things that how to help the children, adolescents to de-stress. Those are some of the things you certainly can do to prevent it from getting worse or prevent it from getting into depression. So those are things you can do as a family. It helps you and helps your children. By helping yourself, it's also to help your children. So do not delay in getting medical care. I want to thank all of you again for paying attention to this talk. I hope that this has been helpful to you. I believe we will have probably some time for Q&A and small group time. I will give this time back to our host. Thank you very much.